today with a question about kinds of things to do over the summer. So, dear Dr. Doreen, my daughter was just diagnosed with autism, age 5. Her deficits are mostly social. Do I do ABA this summer or just put her in a social skills class?
Okay, you do ABA this summer. It's like anything else, I guess, Shannon. Like if your child doesn't do well in, let's say, math or something, you would probably start with getting tutoring before you put the child in a group doing math or something. So the attention that you get and the specific lessons that are important for your child, it's just better to do ABA. And I think it's also important that you don't just do ABA, just general ABA, because a lot of folks in ABA don't really know how to address the social curriculum or the area of functioning that we call social functioning. So for this parent, I really do recommend that you check into skills, maybe even just do the demo, so that you can see the different things that are in the social curriculum, because I think it's our largest curriculum now, and it has there's just so much to teach, and it's such complicated stuff. It's not really done in the standard sit-down discrete trial format. Some of the basic stuff might be done that way, but most of it is stuff that you will want your child to learn in more of a cognitive sense, and then natural environment training, kind of stuff that the child can interact with their environment appropriately. So I think it's really important to check out the skills curriculum, because you will need to have good content, while the technique used will be sort of broader ABA techniques. The content is very important. You do not want to have an ABA program for a high-functioning child working on just social skills. That's just pure, let's say, basic labels and things like that. That's not going to help. You're going to want to go into more conversational language and more advanced things. Having said that, a lot of time, it's unusual. I don't want to make any assumptions here, but it's unusual to get diagnosed at 5 and then to go head straight into just social. Usually when your child is diagnosed, the reason the child has some social deficits is because there's language deficits. So you might need to also do the assessment on skills for the language area and see if there are actually language deficits, because it's very difficult to try to teach our kids to do things like social conversation or any of the social lessons when they really are still having problems with basic language. Yeah. So one depends on the other.
So your answer has sprung a lot of questions up in my head. Okay. First of all, for those of you who are joining us and it's your first time or your second time watching, we refer to the skills program. You can get there as skillsforautism.com. It's a lovely online tool that encompasses the entire curriculum of what is done for therapy at CARD. Is that correct?
Yeah, it's a number of things. I mean, it starts with an assessment. So you answer all these questions about your child, and the program just gives you questions that are age appropriate for your child. So you put in demographics like age and so on, and it'll present you with things that a typical child of that same age should be doing, and will ask you whether your child does those things. And anything that you say, no, my child can't do this, will then connect to a lesson, and the lesson is very detailed and will tell you exactly how to teach it and promote it in the natural environment. Some of the programs also have video clips to show you exactly how to teach it. But the main thing is that it is very, very, very comprehensive. So it will go through several domains, including language, social, play, cognitive, executive functioning, et cetera, et cetera. It just goes through pretty much every area of functioning. So it's the best that we could put out there for families in terms of, and for teachers, and we have a lot of professionals using it as well. Because, ABA is a series of techniques. The content is very important. You can use those techniques, but, how do I get a child who's let's say, nonverbal all the way up to normal. And that's 100 steps, and you have to kind of follow them in the right order in terms of teaching content.
And
So
that's the curriculum. Those are the
curriculum.
lessons.
Exactly.
And that was going to be my next question, because what we're seeing now in this wonderful landscape of 33 states now that have insurance reform, and we go, woohoo, this is fabulous. But what we're starting to see, and what I'm really hearing overwhelmingly from parents, is that ABA is not the same in different places by different providers.
Yeah, that's very, very true. So, the basic definition of ABA would mean that you are, and a lot of people are using now board certified people, BCBAs, and you are generally trained in behavioral techniques. It's sort of a subsection of psychology, but it's all behavior analysis. And really that means that you know how to change behavior. You learn techniques that teach you how to modify behavior. Which means a lot of the behaviorists out there will be very good at trying to help you identify ways to decrease problem behaviors like tantrums or aggression and so on. And they also will hopefully know how to teach skills in one of the ABA formats where our kids understand it very well. So discrete trial is the most popular one, which is really just a very standard format that you present an instruction to the child and you make sure the child is successful 1 out of 3 times at least. And you prompt it, you make it easier, you make it harder, and you give more reinforcer, that sort of thing. So it has a series of techniques that go around it. You break things down into very, very small chunks so that the child can learn them, and then you chain them together, all these different techniques. But, as I said, a lot of people still follow a couple of textbooks that are out there. And those textbooks are very limited in the actual skills that they teach. So it'll be very easy for any behaviorist to teach your child something like labels of objects, or, prepositions, or those basic things that we wrote 20 years ago. But that's a whole different story than teaching the child, how to enter a conversation with a group of children, how to stay on topic, how to repair the conversation when people start walking away, how to pay attention to social cues like children becoming disinterested, all, et cetera, et cetera. I mean, there's millions of things that are very advanced concepts, obviously, that we want to teach our kids, and most ABA professionals don't really know how to do those. And so that's why the content or the curriculum becomes very important.
Right.
And in our program, in the skills program, it really does detail the steps. So if you go into, let's say, social conversation, it's going to tell you that your child needs to have these prerequisites already in place. So certain aspects of pragmatic language have to be present, and if they're not, you go back to that lesson, and you start from the beginning and you just sort of build upon. Otherwise, it's just, it's too complex. It's like trying to teach a child calculus when they don't understand basic math.
Yeah. So am I oversimplifying it if I say that ABA is the teaching technique?
Yes.
But it's equally important that you understand how to do the techniques and then having the proven steps in which to teach them, which is the curriculum.
Yeah, and it's not really even, I guess that's correct, but let me just build on that. ABA is a series of techniques, right?
Okay.
So the things like shaping and chaining and discriminative there's like hundreds and hundreds of techniques that come together, and they're all ways that we will modify behavior, things to do that you can change someone's behavior. You can increase it or you can decrease it. Now with challenging behaviors, we use techniques to reduce them. With skill teaching, we use techniques to increase those, right? Areas that are deficient. But, and then sort of groups of these techniques, clusters of these techniques have been called different things. So for instance, discrete trial training is let's say a protocol that involves things like the discrete trial, reinforcement, of course, short instructions, shaping, chaining, all of these go into the discrete trial protocol. There's other protocols within ABA. So pivotal response training is a protocol, a natural environment training is a protocol. There are some other, and they're slightly different in that they pick and choose different techniques to produce what they are. But nevertheless, they're all ABA. Now, so I I could be an expert in ABA, and I would still, let's say I look at a child and I say, okay, I want to teach this child how to tell jokes, right? And I won't know necessarily what my content is, what my material is. How do you go about doing that? You know all the techniques of changing behavior, but you don't know, you haven't done really a good task analysis or a breakdown of the task of telling jokes or telling lies, those types of things. And so in order to do that, you need to have a whole different, I guess, encyclopedia, which is really the curriculum and skills.
Okay, so it's the two separate components.
Right.
But you have created things that people can use at home to be able to have access to both of those things.
That's right.
So for to learn the techniques of ABA, all those techniques, and to understand all those things, if you thought your head was going to explode when she was saying shaping and chaining and all those things, you thought, I don't know how to do, and a lot more. If that all seems very far away and you don't know what to do about it, you can take classes
on
from
IBT.
Yes, Institute for Behavioral Training.
Right.
And you can learn all those things
in
a very easy way at home. You don't have to go to the library or go to the bookstore or go to the university. You can do it at home on your computer very inexpensively.
Oh yeah, and it's not, I don't want to make it sound like it's overwhelming. It's not. I mean, especially for parents, we've made a whole series just for parents.
Yeah.
And we've made another series just for teachers, and then another series for professionals, which is much harder and much longer. The concept with the series for professionals is essentially we're trying to teach everything that you need to know. It would prepare you for the BCBA exam. I mean, it's very, very detailed and comprehensive, but for parents and teachers, their use of ABA techniques is going to be a little bit different.
Yeah.
So it's much more non-technical language, and as you said, Shannon, it is short modules that you can pick, and you can start with what is autism, and then you can go and look into what is actually ABA, and then the subdivisions of ABA, and how do I handle challenging behaviors, and how do I teach skills, and all the different modalities, and there's a lot there.
Yes.
So,
and it's very accessible. I have to say that again and again and again, because my husband has been doing some of the different learnings, and he is one of those people that he wants to learn techniques to be able to help his child, and he wants to get better at that constantly. But getting him to sit and listen, sometimes when I talk, he goes, "You know what? You're over my head. You gotta." And he's been doing fine on the IBT trainings. And I have to point out too, when we say they're really affordable and inexpensive, sometimes people say that, and I go, well, what's affordable and inexpensive to you? It's $7.50 for some of the trainings. So
7, 10, 12. I think they don't go beyond that.
Yeah.
I mean, they're very low cost.
Yeah. So it's when I say affordable, that's what I'm talking about.
Right.
So that's the component of learning all those techniques that you were talking about, and understanding what it is that you need to do to be able to teach. But there's still that whole other component that you need the lessons, because who wants to reinvent that wheel?
Oh, absolutely. And the sort of the process of developing skills for me was I was just not able to help all the families that were getting in touch with us, and we had all these wait lists, and I was like, oh my gosh, we have to do something about this. So why don't I start publishing our lessons? So we first started organizing these into series of 8 really big books. And as we started doing that, I realized, okay, well, this is all technical language. Like, a parent is not even going to know what an SD or an SR or whatever are these technical terms. And how am I going to give them sort of the basic knowledge so that they can access this stuff? And then I thought, all right, so it's one thing to give them the encyclopedia. The other thing is just teach them the techniques, which is when we started developing the e-learning and all the video-based learning things that are modules that are on IBT. And then after I did that, I realized, okay, well, I don't want every parent to think they have to teach every single lesson in here. There's over 4,000 lessons in there. And I need them to be able to assess their child in a way that the lessons that they pick are very, very specific just for their child. So which is when we spent a few years developing the assessment or the skills index. So, all of it together, I think, gives you all the tools you need. You should learn learn the techniques, and then you should take your time and respond to the assessment. And that will really give you a fabulous baseline or a picture of where your child currently is. And not just across social skills, but across every domain.
Yeah. It's amazing.
Yeah, it is really awesome. I agree. It's a little... I think sometimes parents get a little bit scared because it's overwhelming. It does take some of your time to answer these questions, especially if your child's older or higher functioning. But it is very useful. And actually, over the summer vacation, I'm going to be setting up what I consider to be Skills 2.0. I'm revamping a lot of it and trying to produce formats that are much easier. First of all, I know parents want to be able to pick areas and not have to do all, or I want to be able to give them portals where they can just use one area, like language or social or cognitive. And I also want to just make it much more easy for parents to just select specific lessons and download them and print them, so they don't have to become a member of Skills if they just want to purchase one lesson.
Interesting.
If you are a member of Skills, which is also, I think, pretty affordable, it's $75 a month for a single parent.
Although there's a sale right now.
There's a sale right now still. That's right. We extended the sale, so I think, I'm not sure how much off it is. Do you know?
It is 20% off.
20% off. So,
but that is only until the end of May.
Right.
So,
and when we were pricing this in the beginning, a lot of the parents that kind of came to our focus group said they thought it should be something like $250 a month.
Yeah.
And we just wanted to make it really affordable for people, so we brought it all the way down to $75. And that's if you're one family, and if you have other families and you're a group of people, you can purchase a larger contract, which goes all the way down to like $20 a month, depending on the size. So it is really a very, very useful tool. It's sort of like the WebMD for autism and ABA.
Yes.
It gives you an answer to, it has search functions, it produces reports, it gives you IEP goals, it allows you to track. I mean, a lot of what I'm adding, and not to mention that currently, if you become a member right now, the BIP builder is on there as well.
Yes.
So there's a descriptive functional assessment on there where you answer questions about behavior, and that leads to a behavior intervention plan, a BIP. So you can produce a behavior intervention plan and deal with exactly everything you have to do for the child's challenging behaviors as well. So it does give you a ton of resources.
Yeah.
I think, it's so comprehensive that sometimes it might scare parents or just like overwhelm them, and I have to figure out a way to subdivide it so that it's a lot easier. Or sometimes you may, I don't think it's good for parents to be exposed to all of it. It's just too much. It's too...
Well, the thing that I've taken to saying to parents is get used to the idea that it's this big thing and that you will exhaust yourself trying to use every portion of it on the first day.
That's true.
So pick what you need right now.
Right.
Prioritize in your head, what do you need right now, and focus on that aspect of it, because the truth of the matter is there are so many different ways to use it. And I say all the time here, I'm a big fan of Skills and I'm a user of Skills, but where I'm at now in my life, I'm using it in probably a different way than a lot of people, because I'm using it for my IEPs. I'm checking the BIP that the school gives with it. I'm going in with IEP language to my IEP and saying, here's a lesson I want you to add, because I know it's skill appropriate and age appropriate. And it has saved me an ulcer, I think.
Well, I mean, a lot of times you tell me that you also just pick specific areas that you want Jem to work on, for instance. But you see, the thing for me is that I still think, being a parent myself and having 3 kids, we're all so overwhelmed.
Yeah.
I mean, I can't imagine that everybody's life is as crazy as mine, but perhaps it is. I don't know. I mean, and it is, we don't, if someone came to me, let's say, and said, I want to give you now something that will probably take you about 5 to 10 hours just to acclimate to this software, I'd say, okay, thanks, I don't have time. It's like right now when I receive emails that are more than a paragraph long, it goes on hold because I don't have the time at that moment to deal with it. So I worry about parents having there's not a lot of parents that are like you in terms of, being really willing and able to infuse themselves into the system. If you are a parent, as you know, we have a lot of parents who use it and actually even promote it to other parents, and they love it.
Yeah.
But it is a certain type of person who can do that, and the rest of the population are more like me, where it's kind of like, give me something really easy and step by step. Yes, I want to do stuff for my kid, but this is overwhelming.
Yeah.
So I'm going to try to just make it as, we're doing a lot of things right now. As you know, the DSM-5 came out.
Yes.
So what we're doing is we're also going to infuse some questions that will allow the parent to confirm or not confirm, I don't know what the opposite of that is, reject their child's diagnosis. So that'll help. And then from there, I think, and I don't know, I would really appreciate feedback from families who are on skills, but I'm thinking once you've done that, the system should really ask you, what do you want?
Yeah.
Like, do you want training? And we'll take you to the IBT site, and you can, these are the ones we recommend you start with. Or do you want to assess your child now? And, or do you want to, what areas do you want to focus on? I mean, we have children who are 15, let's say, and the parent is really just interested in, that's either vocational skills on the one end, or they're interested in college prep skills, those types of things. And we should be able to direct parents to specifically where they want to go, rather than this huge supermarkets where you have to kind of find your way.
Amazing stuff. But of course, we recommend both of those places. You can go to ibehavioraltraining.com, and you can go to skillsforautism.com.
And all of that's also on the Center for Autism website as well.
You can go to the bottom of the first page and find all of that there. All right, we're going to take a short break, and we'll come back with more questions for Dr. Doreen Granpeesheh. Stick with us. Welcome back to Ask Dr. Doreen. We have our next question here. It's about seizures. Where can I get good information about seizures? A friend found out that her child was having seizures in his sleep. How would I know if my child were having them? Are there signs?
Well, there's always signs for seizures, but they're not signs that are easy to pick up, especially if it's during sleep. So, I mean, when we start talking about seizures, I think it's very important to get in touch with a neurologist. That is really important, because seizure activity will have a huge impact on learning. And so,
should everyone do that though, or are there symptoms that your child would have that would say to you that you need to?
During wake hours, one of the things that we see often with kids is they will kind of space out, and for periods of time where you can't even, they're really gone, so they're kind of like,
snap them out of it.
Right, and they're gone for, and it could be, very short periods of time. But you have to be able to identify that, and sometimes it's hard. Sometimes other people notice it. If anyone points out to you that they think your child is like spacing out a lot, or here's another one, is losing skills they've already mastered. So that's a big one. If you find that the child masters something and then a week later or whatever it's gone, then that could also be seizure activity. Anything that resembles sort of a blackout period is very important. If your child is at the level where they can recall past events and they have periods of time they don't remember, that of course is very important. Waking up multiple times during the night most of the time ends up being something else. It ends up being like behavioral issues, or maybe even pain related, but not seizures. But having said that, that is probably something that you want to check out.
So rule it out.
I know that it's not easy to actually go and get a neurological test, but it's not as hard as people think either. I mean, if you see I guess you would start with a pediatrician perhaps, or if you have access to your neurologist, you would go see a neurologist, and really the first thing you're going to want to do is an EEG, and that's not that complicated. You're not going to be doing it right off the bat, things like fMRIs. It's just an EEG, and if you're particularly scared of or worried about the evening or the nighttime, then they do a sleep EEG. So, and there are sleep centers around the country that do this. I know UCLA does this. A lot of the bigger universities have these programs where they will actually have the child stay there overnight, and they will have an EEG to monitor their sleep. It's important. It's very important because seizure activity is you know, the activity of the brain, and so it's really important to do that.
I imagine that that's just that much harder. I know I had to go do a sleep study, and you're in a foreign place.
It's hard,
and you got all these clippies on your hair. It's not painful or anything, but you know, to go to sleep.
Right.
I remember saying, and now I'm supposed to sleep with, you know, with the dreadlocks of wires in my hair and a strange bed, strange pillow. And I imagine with a child on the autism spectrum, it can seem overwhelming, but it's important to do.
Well, and there's other things you can do for, I mean, first of all, what I always tell our parents, and that's because like there's so many benefits to doing ABA just aside from the fact that the child's learning. One of the benefits is you can use ABA to measure other things, you know, like that's why we have the clinical timeline on skills, going back to that, but it's so if you give a medication and you want to see whether or not your child's doing better on it, it's pretty subjective usually, except that if you have an ABA program and you're taking data on how fast your child learns things and you introduce a medication, it might have an effect one way or another. And trust me, with the detail of data that ABA people take, you'll see it. Yeah. You'll definitely see whether this medication improved the challenging behaviors and the skill acquisition, or it didn't have an effect. So if you think of that in kind of technical terms, ABA is an intervention, which means in technical terms it's what's considered an independent variable. It's the thing that actually makes a difference. But at the same time, your child's learning at a certain rate, right? Every child learns at a different rate. And that rate of learning is really also a dependent variable. It's sort of the outcome. If you think of your typical children or anyone that's learning, when do we actually start to worry about them is when their learning is slower than their peers, right? When they start to not be able to master things at school, when they have issues that are problematic, all those types of things. So I always tell people, use your rate of acquisition in ABA, how fast my child is learning, as a tool that helps you identify other things. If your child has seizures, believe me, their rate of acquisition is going to be either all over the place, up, down, or they're just going to be flat. They're not going to be learning. So what I always tell our parents is don't really mess with anything. And I'm not just even talking about seizures. I'm talking about anything else, like dietary change. You don't necessarily need to start worrying about things if your child's doing great. Right. If your child's learning tons and tons of things in ABA, in good ABA, and they're just progressing and catching up with their peers, leave it alone, right? Things are going great. But if your child has these plateaus, or if your child really is not, things are not moving ahead, then you have to start questioning everything. And that would be sleep, seizures, dietary change, biomedical, the quality of ABA, everything, pain, you know, GI issues, everything. And you have to figure out why the child isn't moving. Because there should be constant progress. There should be constant growth. You know, if you have good quality ABA, you should have, it's like having tutoring, right? You should have significant growth. I think that's really important what you just said, because I think a lot of times the mentality of the autism parent is you're desperate, right? You don't know where you're going to end up. You're desperate. Then you see a bit of improvement and you become afraid to monkey if you get to a plateau. I hear that from parents a lot, and I've experienced that myself where I'm like we were doing so well there and we got to a plateau. I don't want to break what was working. Like maybe it's this, maybe it's that, and we kind of get ourselves into paralysis, afraid to change something because we were seeing progress for a while. Right. But I encourage parents to actually look at it as sort of, you know, investigative surgery type thing, right? You don't know. Even with typically developing kids, you're not going to know what issues they have unless you're involved in their lives, unless you know exactly how they're doing on every single quiz and test, how they're doing with their friends, how they're doing, whatever it is. And the beauty of skills or some measurement of these things is that it allows you to actually see how your child's doing in every single area. And that is critical, right, Shannon? I mean, it's like if you have an idea, and it's much more complicated than what I just sort of tried to summarize, because when I look at the trajectory of sort of a child's acquisition rate, which I look at a lot of data from a lot of kids, right? And that's, you know, I don't want to keep going back to skills, but the biggest reason we produced skills was to help parents. And then beyond that, we have, you know, once you have 3, 4, 5,000 children's patterns on here, you can start doing what's called a cluster analysis. So we're beginning to look at clusters of kids, which means kids that come in with sort of the same demographics, and they start to progress in the same pattern. And then that allows us to subdivide autism and say, oh, look, here's another child coming in, and they have the same demographics, so they're going to definitely go through this pattern, and we need to make modifications ahead of time for them to be the most successful, because we've learned from other kids.
Absolutely.
So, but the thing about it is, if you have a child and their learning rate is pretty good to begin with, and then all of a sudden it hits a plateau, the very first thing I would do is look at technique, because most often it has something to do with the actual ABA process.
Okay.
And those will be things like, is there enough reinforcement for the child? Is he getting bored? Is the pace fast enough? Is the stimulus, or the stimuli that are being presented, you know, of a form that is perceivable for that child, because children see things very differently. Some of our kids have sensory issues, the majority of our kids do. So a child might be able to focus very well when you're on basic levels of programming and you're dealing with visual stimuli, but they're not going to do very well when you're dealing with like abstract thoughts or abstract concepts that are not visual. So is this one of those, is this child not slowing down just because we don't have as many visual stimuli in the program, or are the visual stimuli too small or too close? Or so there's a lot to check when a child plateaus, a lot of things. In fact, it makes me think I should probably do a checklist of these things, because there's a lot. And once you have gone through and you've determined, no, I've modified my ABA program, it's really the best I can do for this child, then you start looking at things like sleep. Well, I mean, sleep is going to have a huge impact on the child's ability to learn. Health in general, like, is the child actually, you know, having 3 times a day diarrhea, which obviously means he might be dehydrated, or he's not able to focus, maybe he's bloated, those types of things. And you look at things that are even more effective, like seizure activity or what. And all of that is a step-by-step adjustment. It's kind of like dosing, you know. So you've adjusted your ABA, it's good, and the amount is good. The quality is good, and the amount is good, because you know, I want to touch that quickly, because so many parents will tell me, I did ABA, it didn't work. And then you find out, like, I have that right now with some of my parents who will email me and say, I do 1 hour of ABA a week. I mean, it just makes me want to forget it. Right. So ABA dosage has to be pretty intensive if you are really trying to teach a child a lot of things, right? And so, you know, is the amount right? Is the quality good? Am I really getting through to the child in terms of the sensory issues of the child? Is the child sleeping? Does he have other medical issues that I need to fix? Are there seizures? Is there pain involved? Does he have anxiety? All of that sort of has to be controlled so that the child's in their maximum kind of learning cycle.
Absolutely. Wow, that's amazing. I want a checklist now.
Yeah, I mean, I honestly should make a checklist, because it makes me think that it would help a lot of providers, because they would one by one go through these and figure out, like, what have I not done? It more often than not, and I will say almost always, has nothing really to do with a child's intelligence. The children are very intelligent and they learn these things. It has to do with how they receive information. So that's really important.
And that we can manipulate.
You can manipulate, and you must manipulate as a behaviorist. That's part of your job.
That's powerful. That's something that we can get behind and push. That's a wonderful thing. All right, let's take another break and we'll come back with another question. Stick with us for more Ask Dr. Doreen. Welcome back to Ask Dr. Doreen. We have a question that has come in about a 9-year-old. So thank you for all you do. Where can I go to find help with a 9-year-old who does not speak, only grunts, and has many tantrums?
Okay, that's a really good question. Thank you for being sort of just general about it. That's really important because your focus on things change quite significantly when you're talking about a child who's 9 years old and doesn't have any language and grunts and has tantrums. Because you're not anymore focused on trying to teach this child everything they need to know for normal functioning. What you're doing, because it's just impossible at the age of 9, by the time you can't teach that many concepts. What you're trying to do is you're trying to make this child as functional and adaptive as he or she can possibly be. So your focus is very different. And the very first thing, and this is with any child, any age, is to make sure that the child is able to communicate what's important to them.
Yeah.
Now, a child who has no language will probably not be able to communicate all the things that they want or need. I would guess that this child, for instance, if they want something, they might take the parent by the hand to the object, or they might at best point to the object or try to reach it, or if they're 9, they might have already mastered how to reach those objects. But objects are just objects. What if the child wants activities? What if the child wants to go someplace, want to be with someone, is thirsty, whatever? It's a million things, has pain, etc.
Right. The parent who said, I'd like to know what my child wants on his baked potato.
Yeah,
you know?
There you go,
I mean,
right. I mean, all of this stuff. So it's extremely important for this child to get a communication system. Now, he's nonverbal at 9, so it's not really fast enough to want to try to get language. This is the point that you really want to go into a visual program of communication, and especially if the child has tantrums, that tells me that he's frustrated, right? Because all of these behaviors are, any challenging behavior is just a form of frustration. It's just saying, I can't get across what it is I want or what it is I want to avoid, and so I'm going to tantrum. Because when I tantrum, first of all, I'm frustrated that you guys don't understand. I tantrum, and then people kind of let me have what I want, or they allow me to avoid what it is I don't want to do. So this is extremely important for this child to have some level of communication ability, and I really recommend either a PEC system or any kind of augmentative device where the child can, and all the kids are different. Some of our kids only do well with icons, pictures of things. Others do well with written word because they learn to memorize words very fast. We use very often with our kids, we will start out with a PECS program, transfer to an augmentative device, transfer to an iPad with Proloquo, the software, and then transfer further into like an iPhone, or a lot of our kids are just keyboarding what they want now. But it's very, very important to get really good supervision on this, really good advice on how to do this. I currently myself have 2 kids that I do this with. Their ages are different. You know, one is actually an adult and one is a 9-year-old, and I'm setting these systems up for my kids. They're both relatively new to our system because they're frustrated. Because they're frustrated. So your real focus with this child is no longer, let me teach him language or social skills or whatever. Your first focus is really, let me help him communicate with the world so his frustration goes down, so he's actually a little bit calmer, happier, and able to learn. And then you'll go on and start teaching other skills. But the very first thing is to put in a visual system of teaching so that the child can just learn things visually and can begin to communicate. And there's so many rules about this, Shannon, that I wouldn't even be able to go through them here. But I guess the most important thing about this is that the system that you put in place has to be so easy for the child to use that they use it instead of tantruming. Okay, it has to be easier than putting effort into tantruming.
That's got to be the key.
And that's the key. And in order to make something that easy, you have to start out with what we call MANDs in behavioral terminology, which means the child's requests. And pivotal response also talks about this. It's the pivotal request or response. So it's like the thing that the child wants the most. And so those requests, those items that the child wants, you put those first, and the child, all they have to do is, let's say, press a button or touch an icon, and they must get the object. So you have to be careful with that, because those things have to be available. So once you get this idea to the child that this action is going to help you, then learning becomes fast, and the child actually stops tantruming, because now they can get their stuff across.
And
so that's the very. And this parent said, "Where can I get help?" I don't know what state the parent is in. I know that we have specific people who are specialists in just setting this system up, and if you need help from us, you can certainly get in touch with us. I mean, I think in order for you to get this the fastest, I would probably just send me an email. And I will forward it to our remote services. And like, for instance, one of our senior trainers, Sue Cho, she is amazing. And I ask her to come and work with my kids, because she just knows this stuff so well. She's taken so many kids from severe behavior to full communication on these systems. So yeah, I mean, and we have a couple of other people who know this system very well. So yeah, I would really encourage that you get on a visual system.